So the serratus anterior comes from the anterior surfaces of the upper 8 ribs, and it's going to go into that medial border of the scapula. It's going to go right in there. And its primary role is to protract the scapula. It's kind of hard to get it in there properly. There we go. Okay. And its primary role is to protract the scapula, and its nerve is long thoracic. The levator scapula comes from the transverse processes of the upper 4 cervical vertebrae, and it's going to insert onto the superior angle and the medial side of the scapula on the vertebral border. It's going to kind of pull from that very top. And it comes right out the side. So its primary role in terms of the scapula is going to be to elevate the scapula. It also can downwardly rotate because when it pulls on the scapula, it's going to tend to pull this inferior angle medial. And the nerve for levator scapula is a dorsal scapular. So think kind of dorsal fin. The rhomboids, the minor and the major, even though they're 2 separate muscles, they pretty much always work together. And they fill in the whole medial border. Oh, it's the wrong one. Sorry. Where's my rhomboids? They fill in the medial border here. And they're going to come from, the minor comes from C7 and T1. And the, which way do these guys go? There we go. The minor comes from the spinous process of C7 and T1 and kind of fills in the superior part of the medial border of the scapula, kind of from the spine up. So it's going to fill out, between the rhomboids and the levator scap, you pretty much fill out that medial border of the scapula. And then the major is going to come from T1 to T5, and that's going to fill out the medial border of the scapula, kind of distal from the spine. And the rhomboids nerve is, like the levator scap, is a dorsal scapular, and that's helpful to remember that the rhomboids also are going to downwardly rotate the scapular-thoracic joint. Otherwise, the rhomboids, they're going to elevate and retract at the scapula. So coming over to the glenohumeral joint for a minute, I'm going to go through the rotator cuff. And the rotator cuff consists of the supraspinatus muscle, and that's going to be in the supraspinatus fossa in here. And that's going to come over the glenohumeral joint and insert onto the upper facet of the greater tubercle. And it's going to abduct at the glenohumeral joint. Nerve is a suprascapular. And then you have the infraspinatus, and that's going to fill out the infraspinatus fossa, and that's also going to attach to the greater tubercle, to the middle facet. And then you have Teres minor, and Teres minor comes from the superior part of that lateral border of the scapula, and it's going to come over also to the greater tubercle. It's a little bit too big there. He's going to come to the lower facet. Let's see if we're still all here on the greater tubercle here. So all these guys are going to go to the greater tubercle. They're going to fill out that middle, that upper middle and lower facet. The infraspinatus and the Teres minor are pretty similar in function. They're both going to externally rotate, they're both going to adduct, and they both can extend, although they're not primary extenders. The nerve for the infraspinatus is suprascapular, like the supraspinatus muscle. The nerve for Teres minor is axillary, and if you can remember, it's kind of near the armpit. That might be helpful. The subscapularis muscle is going to come from the subscapularis fossa, and that's on the anterior side, so that's going to be this guy up in here. And then it's going to go to the lesser tubercle, because there's no more room on the greater tubercle. Okay, so it fills out, how does that look? It's not quite. It's a little difficult to get this all in here exactly right. It's going to fill out. So I don't know how great that looks. But it's basically going to fill in that whole subscapularis fossa, the whole interior side of the scapula. It's going to come to the lesser tubercle, and it's going to come straight across. So it's going to internally rotate or medially rotate. The nerve for subscapularis is the upper and lower subscapular nerve. So coming back around to the posterior side again in the scapulothoracic, we're going to do the trapezius muscle. The trapezius muscle is a very large muscle. I'm going to put the whole thing on, and then we'll talk about it. Okay, so basically, it comes from the external occipital protuberance, the medial portion of the superior nuchal line, the ligamentum nuchae, which is not on here, but is a ligamentous structure, and then the cervical vertebrae from the vertebrae, the spinous processes of the vertebrae from C1 all the way down to about T12. So it's a very large muscle. It's going to insert onto the spine of the scapula, the lateral third of the clavicle, and he's not quite spreading as much as he should, because it's really going to kind of wrap around. He's a little bit too tall up here. Sorry. So he's a little bit too tall up there. He's going to really kind of wrap around to the lateral third of the clavicle. So you kind of be in front here a little bit. So that spine of the scapula, the acromion, and that kind of lateral third of the clavicle are the insertion spots for the trapezius. So the trapezius has a function at the head of the neck as well, and when it acts bilaterally, so both muscles acting together, it will extend the neck. When it acts unilaterally, it will rotate to the opposite side, and it will side bend to the same side. So when the trapezius acts at the head and neck, it does act as one muscle, but when it acts at the scapula, it acts as three pretty distinct parts. So it acts as kind of the upper trapezius, which is sort of this upper triangle in here. There's a middle trapezius, this part here, that could be a bit better with my lines here. I don't know how well you can see that. And then you have the lower trapezius down here. So the upper trapezius is kind of from those original origin spots, maybe down to about T1 or so, kind of over to the clavicle and the acromion, and that's going to elevate the scapula, and it's also going to help upwardly rotate. The middle trapezius, the part that comes straight across, kind of like a rectangle almost, is going to retract. And the lower trapezius, so coming from about maybe T5 all the way down to T12, and then coming back over to the acromion and the spine of the scapula, that's going to depress the scapula, and it's also going to upwardly rotate as well. And the nerve for trapezius is the spinal accessory or cranial nerve 11, and also gets some innervation from the cervical plexus, as does levator scap. So staying on the posterior side, but going to the glenohumeral joint, we have Teres Major. And Teres Major kind of fills out, it's right next to Teres Minor, and it's going to fill out the rest of the lateral border of the scapula, and it's going to come around, it's going to come underneath the joint, and that's very important, and come around to the, make him a little bit longer here, it's going to come around to the lesser tubercle. Okay, so just kind of distal to the Teres Minor, but has quite a different function. It's below, it's going to adduct as well, like the Teres Minor, but it's also going to, and it's going to extend, but it's going to internally rotate. And that's because it comes around and has this anterior pull that comes over to the front. And the nerve for Teres Major is the lower subscapular. So going to the Latissimus Dorsi, which is a very large muscle, and has kind of multiple origin spots. I'm going to put it on first, so I can get them on right. So Latissimus Dorsi and Teres Major function pretty much together. In fact, Teres Major is called Latissimus's little helper. Let's see if we can get this guy. It's a little tricky to get it all over where it's supposed to be. Okay. About where it's supposed to be. Okay. So latissimus is kind of your flank muscle. It's going to come, it's got multiple origin spots as well. It's going to come from the posterior iliac crest, from the lower ribs, the lower 3 or 4 ribs, spinous processes, thoracic vertebrae 6 through 12. And then it's also going to come from the thoracolumbar fascia or aponeurosis, which I don't really have on here, but that's kind of in this region in here. And then more recently, people have given it an attachment as being kind of the inferior angle of the scapula as well, but it just kind of glides by there. It doesn't really perform it's not considered an important mobilizer of the scapula. So it's going to come around here, wrap around, and it's going to come right into the intertubercular groove, which is that spot between the greater tubercle and the lesser tubercle. And it's going to do the same things the Teres Major does. It's going to extend, adduct, and internally rotate. So even though it's coming from the posterior side, because it comes around over here, it's going to have an anterior pull. The nerve for the latissimus is the thoracodorsal. So if you can think dorsal fin, and it kind of comes from the thorax. And I don't think I mentioned the nerve for serratus anterior, that's long thoracic. Coming over to the deltoid. So the deltoid, delt means 3, and you can kind of think of it as one muscle or 3 different muscles because it's kind of in 3 parts. All right. So when we talk about the muscle as a whole, it's going to abduct. It comes right over the joint, but you can also make it into 3 parts: a middle, an anterior, and a posterior. So the anterior deltoid, the origin spots are lateral third of the clavicle, the spine of the scapula, and the acromion. It's going to insert onto the deltoid tuberosity of the humerus. The anterior deltoid is going to flex the glenohumeral joint. It's going to internally rotate, and it's going to horizontally adduct. The middle deltoid will abduct like the deltoid as a whole, and then the posterior deltoid is going to do the opposite of what the anterior deltoid did. So it's going to extend, it's going to laterally rotate, and it's going to horizontally abduct. And the nerve for deltoid is the axillary nerve. Okay, so now Pec Minor, put that on first. Pec Minor is a scapulothoracic muscle, and it comes from the 3rd, 4th, and 5th rib, and it goes on the coracoid process. It can anteriorly tilt the scapula, and it can depress the scapula. Some sources put it as a protractor, but it's not a major protractor. If that's all that you have, it's not going to cut it. And the nerve for Pec Minor is the medial pectoral nerve. Pec Major is a very large muscle. It's your chest muscle. And I'm kind of putting it in 2 parts here. So the Pec Major we talk about a couple different ways. We can talk about the muscle as a whole, and the origin spots are the medial half of the clavicle, and then the sternum, medial lateral portion of the sternum, you might say, and ribs 1 through 6. And then it's going to insert onto the greater tubercle, which you can't really see underneath the deltoid, but this should be on the greater tubercle. And when the muscle acts as one big muscle, it's going to adduct and internally rotate. But you can also talk about it in 2 parts. You can talk about an upper and a lower pec. So the upper pec, or clavicular pec, you might read about, is very similar to the deltoid. It's going to flex the shoulder, and it's also going to horizontally adduct. The lower part of the pec can extend, okay, because it's going to come kind of just below the joint, and it can pull the humerus into extension. Okay, going on to the elbow, I'm going to start with the smaller muscles first, actually. So I'm going to start with the supinator muscle, which is a relatively small muscle. It comes from the lateral epicondyle, the ulnar ligament, and the radial collateral ligament, which is not on here. The lateral epicondyle kind of wraps around, and it goes to about the posterior or the anterior part of the proximal third of the radius. And from its name, you guessed it, it supinates. Its nerve is radial. And then for what do we have here? Then you have the Pronator Teres. The Pronator Teres comes from the common flexor tendon of the medial epicondyle, which is over here. And it's also going to insert onto the radius a little bit farther down, a little bit more like half as opposed to third. Okay, and the Pronator Teres, it is a flexor of the elbow, though not a primary flexor, and it's going to pronate, hence the name, and its nerve is the median nerve. So you can kind of see how they've got different lines of pull. You can imagine the Pronator Teres pulling the forearm over into pronation. If you can imagine the supinator muscle pulling the forearm the other way into supination. So then you have Brachialis muscle. The brachialis muscle comes from the distal anterior part of the humerus, which is going to be about here. And that's going to come onto the ulna. So I'm going to put this guy down here. Okay, coracoid process of the ulna. And it's a pretty thick muscle. It's actually larger than the biceps. And because it comes to the ulna, it is only going to flex. A muscle has to go to the radius to pronate or supinate. Let's see. So then let's go to Pronator Teres, or Pronator Quadratus that I forgot about. Pronator Quadratus comes from the distal anterior medial part of the ulna to the distal anterior lateral part of the radius. So it comes across quadratus. It's kind of shaped like like a rectangle, hence the name. It's a pronator, and its nerve is median. Okay, so getting back to the elbow, so let's do brachioradialis muscle, and that's going to come from the lateral supracondylar ridge, and it's going to come all the way down to the styloid process of the radius. So let's give it a little bit longer here. So it's a pretty long muscle. And in this position, he's actually in the position that you would, he's flexed, but because he's flexed in that midpoint region, he would actually be using his brachioradialis right here. So lateral supracondylar ridge of the humerus down to the styloid process of the radius. So the primary role of the brachioradialis is flexion, and because it comes right down in this neutral position, it actually can pronate or supinate depending on the position of the forearm. So it can do either. And its nerve is radial, even though it's a flexor. And brachioradialis, I don't think I mentioned, that nerve for brachioradialis is the muscle cutaneous nerve, which is typical of the flexors. All right, so I need to sneak in here the Coracobrachialis. I'm going to have to move some guys over here. So take the deltoid off here for a minute. Coracobrachialis comes from the coracoid process of the scapula and comes down to mid-shaft of the humerus. All right, so I'm going to take off the pec. It's just too hard to get it on there with the pec on there. So here from the coracoid process down to about the mid-shaft. Okay, and so it's going to flex at the shoulder, flex at the glenohumeral joint. It can also adduct in that position. So now I'm going to do the biceps. And the biceps have two heads. One comes from the supraglenoid tubercle around the glenoid fossa. And I'm going to take the coracobrachialis off there because otherwise it's kind of hard to get in there. And I'm also going to take off these guys because you just can't see it otherwise. All right, so take off these guys. So let's look at the so the supraglenoid tubercle is going to be up in here, and it's going to come down to the bicipital tuberosity down here, and the bicipital aponeurosis. Okay, and that's a long head coming from the supraglenoid tubercle. And then you have the short head that's going to actually come from the coracoid process. And they insert in the same spot. Okay, so there's your biceps. So coracoid process for the short head, supraglenoid tubercle above the glenoid fossa for the long head. And they both come down to the radius. Oops, I should get them on the radius, shouldn't I? Let's get them on the radius. on the radial, on that bicipital aponeurosis, which you can't really see, that's just a tendinous insertion, and the tuberosity there on the radius. Okay, so now I'm going to turn around and we'll look at the posterior part of the arm. And I'm actually going to use this other side, which is an extended position, which works a little bit better. So the inconius muscle is kind of a little muscle. People don't talk about it a whole lot. It's an extensor. It's going to come from the lateral epicondyle of the humerus to the ulna. That's kind of a little guy there. Olecranon process of the ulna and kind of that lateral shaft. It's going to extend at the elbow. The nerve is radial, as is the whole posterior side. And because it goes to the ulna, it's not going to pronate or supinate. So finishing off with the triceps are 3 heads. They're all going to go to the olecranon process of the ulna. You have the medial head, which comes from the proximal distal half. A little better. So that's the proximal distal half of the humerus. It's kind of on the more medial side, hence the name medial head. You have the what's called the lateral head, which is lateral, hence the name, and that's going to come from the proximal half of the humerus all the way down to the olecranon process. Okay, so it's going to fill in kind of that lateral side. And then kind of on top of there, you're going to have the long head. The long head comes from the infraglenoid tubercle of the scapula, and that's also going to come to the olecranon process. It's kind of going to cover up the medial head. So for all intents and purposes, the medial head's kind of deep to the long head and then the lateral head. So all the heads of the triceps extend at the elbow. Only the long head, which comes up more proximal to the glenohumeral joint, has the ability to extend at the shoulder, and it can also adduct, and the nerve there is radial.